This podcast is for the lumbar traction modality. Before this modality is applied, the clinician must check for indications and contraindications. The indications for traction include hypomobile vertebrae, disc protrusions, degenerative disc disease, nerve root compression, foraminal stenosis, facet joint pathology, muscle spasm, adhesions, and contracted connective tissue. The contraindications include vertebral fracture or dislocation, acute injuries, hypermobile vertebrae, questionable stability of vertebral column, spinal cord compression, infection, disease or tumor in the affected vertebrae, severe disc herniation, vertebral artery dysfunction, pregnancy, hiatal hernia, abdominal hernia, active peptic ulcers, glaucoma, malignancy, cardiovascular disease, uncontrolled hypertension, aortic aneurysm, frail older adults, rheumatoid arthritis, and osteoarthritis. When setting up this modality, arrange the thoracic harness and pelvic corset on the table in the proper position. The thoracic harness should be placed by the bottom edge of the table split, and the pelvic corset should meet at the table split while overlapping the thoracic harness. Ensure that the traction table is unlocked. Once the straps have been laid and the table is unlocked, the patient will lie on the table aligning with the straps. The pelvic corset should be placed 1 to 2 inches above the iliac crest. Then the straps should be wrapped around the patient in a snug manner that still allows the patient to breathe. The belt should then be cinched with a circular ring in center with the body. The J-hook will then be connected to the circular ring. The thoracic harness should align with the patient's torso, with the top of the harness being 2 to 3 inches below the axilla. If the patient is in the prone position, after the harnesses have been cinched into place, connect the J-hook to the center circle in the patient's back. Release the rope tension to connect the patient to the machine. Then place the bolsters under the patient's dorsal ankles. Ensure that the angle of the rope is correct and adjust the height of the table if necessary. When the patient is in the supine position, holsters should be placed under the patient's knees, and the traction rope should be connected to the ring on the long strap between the patient's legs. Once connected, the slack on the rope should be removed. Adjust the height of the table to ensure a proper angle of pull, which should be about 25 degrees. The interrupt switch should be given to the patient in case of apprehension. To initiate treatment, select lumbar traction and select the position of the patient. The patient can either be pulled into extension in the prone position or pulled into flexion in the supine position. After selecting the position, select the Edit button to change and modify the settings. This will bring you into the settings menu. There are several settings that can be changed. Begin with determining the minimum and maximum loads. The maximum load is 50% of the patient's body weight. If the patient is apprehensive, set the maximum load to 30% of the patient's body weight. A patient who weighs 120 pounds will have a 50% maximum force of 60 pounds. The minimum load is 30% of the maximum load, or roughly 17% of the patient's body weight. For this patient, the minimum load is 20 pounds. The clinician may want to include steps to acclimate the patient to the total load. Select the progressive steps to determine the amount of steps needed to reach the maximum load. It is usual for the progressive steps and the regressive steps to be the same number. Select the regressive steps to determine the amount of steps to return to the starting position. If the time needs to be adjusted, select the time button and adjust to the desired time. The speed determines how fast the patient will reach the maximum load. Select speed to change to the desired speed for the modality. If the patient's situation calls for hold and rest times throughout the treatment, then select the hold rest time and adjust as needed for the individual patient. Ensure that there is no tension on the rope. Once the patient is ready, press the start button.